Good morning, Dr. PK from DrPKLyfe. This video is about hormone replacement therapy after menopause. Treatment options, indications, contraindication. I'm going to explain that very simply. That's why I try to do every in my videos so that you understand very clearly. So menopause happens when ovaries stop making estrogen and progesterone. I think all of us know that. This hormone drop can cause uncomfortable symptoms and long-term health changes. Hormone replacement treatment means giving back some of these hormones to relieve symptoms and protect health. But it is not for everyone though. So let's break it down clearly. Why consider HRT after menopause? HRT is mainly used to treat symptoms, not to reverse aging. Common menopausal symptoms are like hot flashes, night sweats, vaginal dryness, painful intercourse, sleep problem, mood swings, anxiety, brain fog, rapid bone loss, that's osteoporosis. Types of hormone replacement therapy. Number one, estrogen-only therapy is used only if the uterus is removed, hysterectomy. It comes in pills, skin patches, gels or spray, vaginal creams, tablets, and rings. Estrogen alone can increase uterine cancer risk if uterus is present, so remember that. Number two, combined estrogen and progesterone is usually good for women with intact uterus. Progesterone protects the uterus from estrogen overstimulation and it's given as continuous, like a daily um, uh, tablet of both hormones. And there's other one, it's called cyclic, um, where progesterone is added only for certain days of the month. And then you have a local vaginal estrogen, very low dose, used only for vaginal and urinary symptoms, like people who have lots of dryness, frequent urination, frequent burning, and things like that. It has minimal absorption into blood. It's much safer for many women, and it keeps local tissue very healthy. Bioidentical hormones. It's chemically identical to natural hormone. FDA approved forms exist and preferred. Then you have a custom compounded hormones, which is less regulated and has a variable safety. Who benefits most from HRT? HRT is most effective and safest when started within 10 years of menopause, before age 60, and for moderate to severe symptoms of hot flashes, night sweats, vaginal symptoms, and high fracture risk from osteoporosis. So, long term benefit and short term benefit of HRT. Short term is that it reduces hot flashes by 80 to 90%, improves sleep and quality of life. Um, it improves libido and sexual lifestyle as well. Long term, it prevents bone loss and fracture. It improves vaginal and urinary health. Um, and some cases, it has been seen that it may reduce diabetes risk. Contraindication: who should not take systemic HRT? Now, HRT is not recommended if you have history of breast cancer, uterine or ovarian cancer, unexplained vaginal bleeding, blood clot like a deep venous thrombosis or pulmonary embolism, stroke or heart attack, active liver disease, or known clotting disorder. Now, you have to be very cautious if you have strong family history of breast cancer, or somebody with a strong family history, or somebody with migraine with aura, or uncontrolled hypertension and a smoking history of more than 35-40 years. Risk of HRT, it depends on the type, dose, and duration. Breast cancer risk is there, mainly with long-term combined therapy, and risk of blood clot, higher with oral estrogen, stroke risk for older women, and gallbladder disease. Um, Transdermal estrogen patch or gel has lower clot risk than pills. How long HRT can be used? Um, Shortest duration needed to control your symptoms. You got to be reassessed every year. Many women they use it for 3 to 5 years safely, and you need to take the lowest effective dose. Vaginal estrogen can be used in the long term, okay, because it's not absorbed systematically. You have non-hormonal alternative if HRT is not suitable, like for those people who should not be taking it because they have contraindication. SSRI, gabapentin, clonidine, vaginal moisturizer, lubricants, calcium, vitamin D, and weight-bearing exercise. So HRT is highly effective for menopausal symptoms. Best started early after menopause. Must be individualized. Often outweighs risk in the right patient. There is no one size fits all. And it's always important you talk to OBGYN and go with the risk factor, your expectation, long term and short term, and then make the decision. So thank you for watching. Dr. PK, please share, repost, and like my channel and ask any questions. Thank you.